In Syria, aid workers have started to move critically ill children from a rebel-held suburb near the capital, Damascus. After months of negotiation, 4 patients were taken out of Ghouta on Tuesday night. But the UN Special Envoy to Syria has told the BBC he fears the children are being used as bargaining chips. Jan Egeland said he understood rebels in eastern Ghouta had agreed to swap captured government workers in exchange for the children. Another 25 are expected to be moved in the coming days, though hundreds more are in urgent need of treatment. Around 400,000 people have been under siege by government forces since 2013. Let's speak now live to Dr. Ahmad Tarakji. He's president of the Syria American Medical Society. He's in Fresno, California now. Dr. Tarakji, thank you very much for your time. Good to talk to you. It has taken, as you know, months of negotiation just to get these few people out. Is this just a humanitarian gesture by the Assad government, or are these children effectively bargaining chips?
Well, first of all, I just want to express that the patients, or some of them that are being evacuated, they are happy. They feel that there is hope for the future. Having said that, we're talking about 29 total if the evacuation took place out of hundreds of patients who are in dire need and they're at risk of death from treatable conditions. So that does not make sense that this is not a humanitarian deal, so to speak. Unfortunately, we've seen many elements that undermine the humanitarian operation to help the patients who are in need, to evacuate the ones who are in need, and to treat the ones that we can treat in eastern Ghouta at this time. We know that 4 months ago, when we started reaching out to the UN security members as well as the UN leadership, we provided that list of 29 patients back then, that those are the patients in urgent need. Since then, the list grew up to like 500 plus, and now we're seeing those 29 being approved. But not just that, not just the starvation is going up in eastern Ghouta, but also even the evacuation process itself. The draft that's being shared is different from what we proposed. It has many violations of international humanitarian laws, and that makes us suspicious that there are some other deals being in place and using, as you said, using the humanitarian needs as a chip, as a bargaining or some position to some deal to negotiate a better political position.
So in exchange for freeing sick children and other people, the Assad government is getting something in return. We were also hearing, perhaps you can confirm this, that some of those who've been in the rebel-held area, as you say, besieged for about 4 years, are uncertain about accepting evacuation because they worry, however sick they may be, if they go to a government-held hospital, they may face arrest and interrogation or worse.
Absolutely, you're absolutely right. Actually, as a matter of fact, today, like a few hours ago, the last patient who was on the evacuation list refused to go out after he had a look on the draft of evacuation that's being somehow approved. And that draft does not guarantee the safety of the patient, does not guarantee the right to go back to home, and God knows what kind of quality of medical care they will be provided. All those supervisions are not well described in this draft, and that patient, like many others, refused to go out. And that's why we feel that providing aid to the citizens in Ghouta is more appropriate. That will stabilize the community, that will prevent them from having massive displacement, which many of the citizens of Ghouta right now believe that the besiegement of Ghouta aims to achieve the displacement of the people.
Dr. Tarakji, we'll be keeping a close eye on this, as of course you will be. I'm sure we'll be talking to you again. Thank you very much.
Thank you for the opportunity.
An improvised explosive device has gone